Obstructive airway disorders are caused by disorders that limit expiratory airflow. They involve the smooth muscle tone, affecting the radius of the airway, the mucosal lesion and the obstruction due to secretions, that affects the airway permeability. The bronchial smooth muscle is innervated by the autonomous nervous system. The parasympathetic nervous system causes bronchoconstriction. The sympathetic nervous system produces bronchodilation. The conditions included here are asthma, and chronic bronchitis and emphysema that are considered together as chronic obstructive pulmonary diseases or COPD. Asthma comes from the Greek word for panting, which makes sense because it causes chronic inflammation of the airways, making them narrow and more difficult to breathe through. People with asthma can have asthma attacks, which are usually triggered by something in the environment which causes immune cells to generate inflammation in the lungs, which can make them even narrower and potentially be life-threatening. So, if we take a look at the lungs, you've got the trachea, which branches off into right and left bronchi, and then continues to branch into thousands of bronchioles. In the bronchioles you've got the lumen, the mucosa, which includes the inner lining of epithelial cells, as well as the lamina propria, and the submucosa, which is where the smooth muscle is located. The molecular pathway that leads to asthma is actually pretty complex, but it is often initiated by an environmental trigger. In asthma there is often an excessive reaction from type 2 helper cells against specific allergens. Th2 cells are an immune cell subtype, which are known to be involved in asthma, as well as in atopic dermatitis, and allergic rhinitis, making up what is called the atopic triad. What can happen with asthma is allergens, like cigarette smoke, are picked up by dendritic cells that present them to a Th2 cell, which produce cytokines like I-interleukin 4 and interleukin 5, leading to a number of features of asthma. For example, IL-4 leads the production of IgA antibodies which coat mast cells and stimulates them to release granules containing things like histamines, leukotrienes and prostaglandins. IL-5, on the other hand, activates eosinophils which promote an immune response by releasing more cytokines and leukotrienes. In this case, since IgE antibodies are being produced, this is an example of a type 1 hypersensitivity reaction. This leads to two series of events. Early on, minutes after the exposure to the allergen, smooth muscle around the bronchioles starts to spasm and there is increased mucus secretion. This narrows the airways, making it difficult to breathe, and this is why asthma is considered to be a type of obstructive pulmonary disease. There is also an increase in vascular permeability and recruitment of additional immune cells from the blood. So, a few hours after exposure, these immune cells, especially eosinophils, release chemical mediators that physically damage the endothelium of the lungs. Initially these inflammatory changes are completely reversible, but over the years irreversible changes start to take place, edema, scarring, and fibrosis build up, leading to thickening of the epithelial basement membrane, which permanently reduces the airway diameter. Although the specific causes of asthma are ultimately unknown, it is thought to be caused by a combination of genetic and environmental factors, since certain genes have been identified that increase the risk of developing asthma, and having a family history of asthma seems to increase risk as well. Medications like aspirin and beta blockers have also shown to trigger symptoms in some individuals with asthma. For environmental factors, the hygiene hypothesis suggests that reduced early immune system exposure to bacteria and viruses may actually increase the risk of later developing asthma, possibly by altering the overall proportion of immune cell subtypes. In general, causes of childhood asthma diagnosed before age 12 are thought to be due to a stronger genetic influence, whereas later onset asthma is more likely to be largely due to environmental factors. Now, the triggering substance that leads to the asthma attack can differ from person to person, but some common ones include air pollution, like cigarette smoke and car exhaust, as well as allergens like dust, pet dander, cockroaches, and mold.
That said, symptoms of asthma include coughing, a feeling of chest tightness, dyspnea, and wheezing, or a high-pitched whistling sound that usually happens during exhalation. Occasionally in the sputum Kirschmann spirals may be found. These are spiral-shaped mucus plugs which are basically elongated mucus casts from small bronchi of people with bronchial asthma. Mucus plugs can be particularly dangerous because they not only block exchange of air, but they also block inhaled medications from getting to the site of inflammation. Diagnosis of asthma is based on anamnesis, physical examination and laboratory findings like with any other disease, but here lung function studies are very important. Spirometry is a device that can measure the forced expiratory volume in 1 second and the peak expiratory flow rates, both of which measure the amount of obstruction in the airways. To provoke an attack, the patient inspires cold air or histamine to take the measurements. Now, asthma can be classified according to the frequency of symptoms, in particular nighttime and early morning symptoms, and also how often a person is using asthma medication to help with the symptoms. From least to most severe, the types of asthma are intermittent asthma, mild persistent asthma, moderate persistent asthma, and finally severe persistent asthma. While there is no cure for asthma, there are treatments available that can manage the symptoms and prevent the development of an asthma attack. First, people with asthma should avoid contact with triggering substances by vacuuming, removing carpets and rugs, and changing the environmental conditions, like for example, drying out a room in the case of molds. There are also a number of medications that can reduce the symptoms of asthma. Bronchodilators such as short-acting beta-adrenoceptor agonists and anticholinergic medications are often provided through inhalers. These fast-acting medications cause the smooth muscles in the lungs to relax and therefore dilate the airways, opening them so that a person can breathe. Individuals with more severe forms of asthma might need additional treatments like daily corticosteroids, long-acting beta-adrenoceptor agonists, or leukotriene antagonists. In very severe cases, intravenous corticosteroids, magnesium sulfate, and oxygen therapy might be needed. To finish, and regarding severe asthma attacks, have in mind that they have become quite frequent, and that may evolve really fast, causing dysrhythmia or suffocation, and therefore killing the patient. So never underestimate an asthma attack in your clinic or on the street. That was all for asthma.